Hey guys, it's Straight to You Wellness. In this video, we're talking type 2 diabetes. Type 2 is, in my opinion, one of the most poorly managed conditions in all of healthcare. Very poorly managed. Why? Well, you go in, check in the boxes, they do some lab work. Oh, take this chemical cover up, take this insulin, whatever it might be. They ignore the underlying root cause. Now, the question is type 2 reversible? It is. I've had patients come through my functional protocols with amazing success. We have a high success rate if you follow the protocols. What you need to understand about type 2 diabetes is that you have to fix the cell. You have to look at things from a cell's perspective because your cells make up your tissues make up your organs. So, if your cells are damaged, if they're inflamed, if they're broken, your tissues are going to be broken, and then your organs are not going to function properly. So, in order to truly get well, you have to fix the cell. Write that down. In order to truly get well, you have to fix things at the cell level. We have to look at the receptors. We have to look at inflammation. We have to look at lifestyle factors. What we do as functional providers is we dig, find, and work towards fixing the underlying root cause, solving the puzzle, not just spending 5 minutes with you and now take this, then come back in 6 weeks. We're not just trying to fix a bunch of blood work. We're trying to get people healthy, so we have to look at the foods, we have to look at the nutrients, we have to look at the toxins and bad fats and sugar, including the hidden sugars and inflammation and cell health and gut health. We have to look at things from a holistic perspective, from a global perspective. You're more than just a lab marker. We have to look at the big picture, and that is why what we do works so well. So, if you're struggling with type 2 and you want help getting this thing reversed, remember just look at some stats. Here's the scary thing about type 2 diabetes: there's 30 million Americans that have it. That's 1 in 10 people, 1 in 10 who have full blown type 2 diabetes. So, if you're thinking that you're alone, you're not alone. Type 2 is a big problem for a lot of people, and it's because a standard American diet is full of sugar, it's full of carbs. Carbs are essentially sugar in disguise. So, the standard American diet, we call this SADI diet, but it's the fastest way to destroy your health. It's the fastest way to disease and dysfunction, and usually the end result is type 2. So we have 30 million Americans that have it. But the scary part is that we have 88 million that have prediabetes. We have 88 million Americans that have prediabetes. That's 1 in 3. 1 in 3 have full blown prediabetes. Let's just call it prediabetes, where if they don't take action within 5 years, they're going to eventually graduate into full blown type 2. With type 2 comes consequences. Your eyes go bad, your kidneys go bad, you get numbness, tingling, pins and needles. You get neuropathy, your feet start, some diabetics will have their legs amputated at the knees. This is a nasty, nasty condition and it is fixable. It is reversible. If your medical doctor said, no, you can't fix, punt, get a second opinion because it is reversible. We've been doing it for almost 2 decades at this point. So, your next step, if you want some help, what I want to do is offer you a one on one discovery call. This is not a high pressure, pushy sales call. This is not that. This is simply a chance to ask each other questions and determine if what we have would make sense for you. I use an analogy. If I'm trying to go from California to New York and I don't have a map, I don't have a blueprint, a way to get there, how successful would you think I'd be? I'd be all over the place. I'd be lost. I'd be frustrated. I'd be confused. But if I had a straight line path, do this, do this, do this, do this test, avoid this. If I had a straight line path, a blueprint, a map to get there, that's what we have with type 2 diabetes, and I want to give it to you. So understand either myself or one of my partner practitioners will be giving you a call. I have a big team and we get the job done when it comes to type 2. But again, your next step, click the button, fill out your information. Either myself or one of my medical team will be giving you a call at the time that you choose. So you pick the date and time, we'll call you then. Thanks for watching.